What do we want?
Pay restoration.
When do we want it?
Now.
What do we want?
Pay restoration.
When do we want it?
Now.
What do we want?
The power to stop these strikes lies squarely with this government. That is a direct quote by Wes Streeting himself when he was a shadow health secretary in 2022. You're now the current health secretary, willing to negotiate with you at any time. All we're asking is for you to give us a credible, serious offer in regards to pay and jobs, so patients that I've seen, for example the patient with the back pain, can see their GP on time, can be seen by emergency doctors quickly. We're having doctors going overseas. We're effectively subsidizing doctors to be trained overseas with UK taxpayer monies. We have doctors who cannot work, who want to work, who need to get into jobs.
It's so frustrating that the BMA are embarking on this totally unnecessary strike action, given resident doctors have had a 28.9% pay rise and the highest pay rise in the public sector 2 years in a row. And a poll in the Times today shows that had they put the deal I offered them to their members, these strikes would not be going ahead. There are consequences for these strikes, as much as the BMA want to try and ignore them. It means disruption to patients despite our best efforts, and I don't take lightly the fact that people will be having appointments, tests, scans and treatments delayed because of this irresponsible action. I think that's grossly unfair. It will also have an impact on NHS finances. I mean, these rounds of strike action cost around £250 million. I'd rather be investing that in frontline care for patients. We could also improve conditions for doctors, as I offered. The more the BMA do this, the more they risk setting back the progress we're making, progress that's seen waiting lists fall for the first time in 15 years, ambulances arriving 10 minutes faster this year than they did last year, and patient satisfaction rising with GPs. The NHS is on the road to recovery. This weekend is going to be a real bump in the road, but I'm determined to make sure we put our foot down the accelerator and give the public the NHS they deserve.